we have a lot of our brain that we never ever use. So we're creating a new pathway to an area that we can certainly stimulate to do other things, but you're going to be within the same genre. So, you know, if it's a motor nerve we're trying to stimulate, you're going to stay within the motor cortex. If it's something in the social brain, we're going to stay within that period, in that space,
Right.
but create new pathways and make that a better connection. Even kids with autism, you know, we're finding that with neurofeedback, we're stimulating their social brain better so that those connections that are faulty, so they have a lot of affects and they have a lot of difficulty with social skills or learning social skills or social cues, that neurofeedback can strengthen that pathway so that the connection is much stronger, so that they don't have, their symptomatology doesn't display as severely, let's put it that way.
Is this for like all stages of autism? Because I know people are on the spectrum from.
Yeah, they're doing a lot more studies on neurofeedback. They're actually putting kids in a functional MRI and they're having them play brain games. So they're actually watching in real time what their brain is doing and trying to connect different pieces of their social brain. So it's kind of neat. So there's still a lot of sort of research going on. And this has been in the university settings for 40 to 50 years. It's always been really expensive because you can't get a functional MRI every 5 minutes. You know, that's not a thing. So when they brought about the QEEG, which is something that's been in neurology for a long time, they said, okay, we can measure the brainwaves with that and then compare to our normal database of all this information that we've taken over the years. We can use it in a much more cost-effective way. So now you're going to see it more in the clinician's hands and it's becoming much more popular. And they're using it in sports, you know, we even do sports enhancement, stress management, that kind of stuff. It's about keeping the brain active and learning how to use it better and make the brain healthier over time.
So you said that you can look and see either ADHD or the TBI or whatever. So if a client came to you and didn't tell you what he or she was struggling with, you could actually identify it, or do you have to hear them say, I've had depression, and then look for it?
No. And I always tell people come to me in all different stages. Some of them are diagnosed, some of them are undiagnosed. Some of them are on medication, some of them are not on medication. It really doesn't matter to me. I don't care what you call it. I care about how you're using your brain. Because you've also created a lot of accommodations too. So a lot of coping mechanisms. So the map is a pure piece of science, I like to say. That tells me definitively how are you using your brain. And then we look at the symptomatology and saying, okay, well here's how we've accommodated to the way we are using our brain. So I don't really care what you're diagnosed with, and I don't diagnose you, so it doesn't matter to me. I care about how you're using your brain and what brain waves are active and which ones are you have too much of, too little of, and why. Why does that happen? And then as far as people being medicated, you know, medication is altering the chemical balance of your brain.
So if you don't have enough dopamine, you have a medicine to try to give you more dopamine.
So the way neurofeedback works is we're stimulating that brain wave to let down the neurotransmitters
that would produce naturally. Dopamine.
Exactly. So we're teaching your brain how to do that correctly instead of taking a chemical to either
keep it,
to offset it or reabsorb it or not absorb it or whatever, or have more of that situation available to you. So we're always looking to alter our chemistry. This is just a different way to do it naturally, and to teach your brain how to do that. I always say go back to factory settings almost.
Yeah, kind of. Okay, are you able to help me understand how you do that? Like, give me more of the science while we're here. I know I'm not looking at any MRIs or any EEGs. So So what would I look for to help me?
So what we do is we do brain mapping. We actually measure brain waves in several areas of your brain, and then we compare that to your symptomatology. We compare that to the normative database of your age and your sex, and we say, okay, you say that you're having issues with attention, and that area of your brain is either functioning correctly or not functioning correctly, meaning that your frontal area either has enough beta or not enough beta.
What's beta?
Beta is your fastest waveform. So when we're outwardly thinking, when we're doing math problems, when we're engaged
in talking in this conversation.
Exactly. So you want to be in beta. But you don't want to be in beta all the time, because when you have too much beta, that produces anxiety. When you have too much beta all the time, or you have beta in an area that governs sleep, then you don't sleep because you're not using a delta, which is what you should be when you're in sleep mode. So we see what areas of the brain and what brain waves you're using, how much of them, and how efficiently are you using them, basically, with the brain map. And then from there, we go into a training program. And we do at Wright Brain Core, we do two different types of neurofeedback. We do fast wave training and we do slow wave training, and they're for very different reasons. Fast wave trading is super cool and it's very easy. The person watches whatever they want on television. So I put on something from Netflix that makes them joyful. I like to train in joy. It really doesn't matter ultimately what you're watching as long as you're focused on the screen. So I could put a book up there. I could even do a piece of music for if you're visually impaired, or we can just do visual if you're hearing impaired.
But find something that brings that client joy.
Right. I like to train in joy because, you know, most of my people are coming with anxiety and depression. So
you don't need to
they're
bring
not,
them into
yeah, we're not going to be
emotions.
watching American Horror Story when you're training because I don't do that. But you could, but I don't like it. So I make them find something that's joyful that they're interested in, and they watch the screen. So with the training program, so let's say I'm trying to train you to have less beta in a certain area of your brain. So it will train, and every time you produce less beta, you'll get to watch the movie, and it'll get louder in your ears.
It's like Pavlov in your brain.
It's extremely it's very operant training, so it's very Pavlovian. So every time you do something right, you get a cookie in your brain. So then you don't do something right, and it gets darker in your brain. It's like, wait a minute, what did I do to make that happen? So it forces the brain to go into its normal calculations.
Find the cookie.
Exactly. So, and that's how, and we reinforce it, and that's how we train a new pathway. And then we can see how the pathway is doing because we're constantly watching what the screen is doing, and we record it so that we know for next time, okay, now we need to do it this, and it gets harder as you go on.
Well, give me an idea. Okay, so I'm a little bit, all right, so you've accidentally found beta in a spot, and then I'm watching this show on wherever, Netflix, and it's making
Great
me...
British Baking Show is like one of the favorites.
Right.
It's hilarious.
Okay.
I love that.
What would I be watching? I'd be watching like
Got a
The
lot
Cake Boss.
Yes,
I love
we
it.
have that, yes.
Okay, so you something lights up. It's like, oh, good, we got her beta into this correct spot.
Right.
How do you get it to go there again? You got to keep going until it accidentally goes, or did it accidentally go there and you found out what stimulated it to go to that new spot?
So we're trying to stimulate you to do the right thing. So it's between the fader gets incrementally dark and light. So it's stimulating that waveform in a certain way. So we do another thing called bionicity. Bionicity is like what we do in between time. It's a program that you can watch. So say you're having trouble sleeping. You watch a video and that kind of has the flashing light effect. So we'll either flash it in beta, or we'll flash it in theta, or we'll flash it in delta or alpha, so that you can get the desired response. So if we're trying to wake you up, we'll give you more beta. If we are trying to slow you down, we might give you a theta or a delta wave, but it'll flash in that waveform. So very similar to what the fader is doing. So we're encouraging that waveform, but once you get it, you get to watch your movie. And then every time you do exactly the same thing, you get to see it in a certain amount of brightness.
You're not watching the movie the whole time, you get it as a reward.
Yeah, you are seeing it in the whole time, but you're seeing incrementally. So sometimes it's a little bit dim, sometimes it's very bright, but your brain is always looking for very bright. So you may see it, you might just be missing the mark a little bit. The more you do it correctly, the brighter it gets, or the louder it gets in your ear. And for some people, that's really annoying because they're like, I'm in the middle of my show, like I want to hear it. So they're gonna be like super focused on what that was. So the more engaged they can be with what they're watching, the better. But yeah, that's how it works. It's super simple. It's very simplistic, and people are like, how can this work? But it really, really does. And it also puts you in that state of being. So when you're not in training session, your brain is looking for that in the
level
world.
Of light,
it's looking for that level of light. It's looking for that waveform that it's missing, that it is craving, because again, once you hit that sweet spot with that wave that we want you to have, you're going to let down the neurotransmitter. And you like that neurotransmitter, so you're going to keep doing that, and that's how we strengthen pathways, and that's how you become more neuroplastic, and that's how you can get off medications, because what's the medication ultimately doing is giving you that chemical on demand. We're teaching your brain how to do it on demand, so that you don't need that chemical anymore.
Yeah, I should have had Ellen call in. My voice teacher, Ellen Petco, is.
Ellen.
I know we
I
all
love you,
Ellen.
Elle.
I do too.
I think you're awesome.
Go if you want voice lessons. Call Ellen.
Amazing.
No, she is. But see, look, she gets a free plug here, right? She was medicated for depression for 15 plus years.
Yes.
And she saw you.
Yep.
And she is no longer medicated,
Yep.
very happy, joyful.
Yes.
She just can't speak enough. So speak to those people who have been dealing with depression and have just about exhausted everything they can.
Yeah, and again, you're nothing but a giant pile of chemicals in your brain, and we're always looking for the chemicals that make us feel the best.
I'm made of bacon.
It's right. We always love bacon. Bacon's a very special
You're
neurotransmitter, and we love it. But you're always looking for that chemical, and people that self-medicate, so people that have a drug and alcohol addiction, those who take prescription medications, it's all about altering your chemistry. So we're teaching your brain how to get its own chemistry on demand the way it's meant to be, in the way that you're meant to function, so that so your heart beats properly, that you feel love and joy and emotions, that you feel even anger and sadness in the right amount of tonality, because that's what our chemicals do for us.
So what I'm hearing is this is people who have alcoholics, people who've been victims of sexual abuse.
Yeah, PTSD. That's my story. So I have PTSD. That's how I kind of got into it. No.
We got time. Do you mind sharing? Because I was going to ask you, how on earth did you get into this?
Yeah, so I have PTSD. I also suffered from anxiety and depression most of my life. I was an abused child. Very long story. Yeah, a lot of sexual abuse, and there was physical abuse in my house, a lot of emotional abuse, you know.
They always usually come together.
Yeah, so there's a lot of layers to that. And there's a lot of layers to healing as well. But so I went through that, and then I had.
At what ages?
My first remembrance of sexual abuse was I was 4. So.
And then the last that you remember?
Yeah, probably. Well, and then. So anybody who's ever been sexually abused, then you go through your teens, and then you're like, okay, so this is my self-worth, and then you start becoming your own self-fulfilling prophecy.
A lot of girls start sleeping
so
around.
So now you get
and
promiscuous and all that stuff. So you kind of go through that. So it kind of never ends until you get healthy, you know what I mean? So throughout my entire lifetime, I have unhealthy relationships.
Right.
Yeah, because you're like, well, that's my self-worth, and this is what I'm meant for.
This is what guys want. Well, it's also, I teach the sexual assault classes, so it's always about power and control, as well as I'm going to try to take back my power. And you're actually surrendering even more of it, you don't realize it. So just enough for our listeners to get.
I've lived the dream, know about that. So, so there's a lot of layers to that. So I can't say there was really an end.
But you're looking at, you've gone through your youth and your 20s minimum, carrying this brokenness.
And 30s, sure.
And your 30. Okay, so we're looking at 3 decades.
Yeah.
Okay,
absolutely.
So keep taking us then.
So, and then I had my daughter when I was 35, and she suffered from anxiety and depression, and she also has ADHD. Well, she has ADD, they don't call it that anymore. She has no H, there's no motivation, there's no H. I wanted a little bit of H, but she just didn't have any.
She can get some from my
just the sloth going to class, and it was a drudge, and everything was drudgery. And I love her, she's amazing. So we came across neurofeedback from a therapist that we were both seeing. And at the time, I didn't know that I had PTSD. I had gone through my 20s medicated.
I'm alive, I'm functioning,
I'm good. Intellectually, I knew, I was abused, and I got over it, and life is fine.
But you weren't realizing your heart and your soul were still affected by it.
Exactly, and that's a whole nother journey. So we started doing neurofeedback, and I thought, this is amazing. Like, I saw the difference in her first, and I was like, this is really amazing. I need to find out more about this for myself. And then I had my first PTSD trigger, and this was about 5 years ago, and went down the spiral of having triggers all the time, never had them before.
Why? Why do you think you...
Again, levels of healing. I think God and your body only give you what you can handle at the time, and it just happened to coincide with a time when I was trying to get really healthy, and I was trying to lose weight, and I was taking care of me for the first time.
Oh, that's Satan. He was trying to destroy you, so he sent that trigger.
Yeah, so trying to get healthy, trying to do all the right thing. I'm like on a diet, I'm finally losing weight, things are great, life is good. And all of a sudden, I have my first trigger, and I almost, at that point, disassociated, and it was very scary. I had all these glass boxes in my head, and all of a sudden, I watched them explode, and I felt my soul completely shred. And I have never been the same again since then.
That's good though, right?
It's good, yeah.
You needed to go to the pit.
I had to go to the pit.
As if the sexual abuse wasn't enough of a pit.
Right. Well, then I started, so when the boxes exploded, I know this is kind of heavy, but...
Not to me, I got this.
You start seeing your life in a giant puzzle piece, and all these pieces start connecting, and you're like, that happened to me, caused me to do this, and then I made this decision, which happened because of that, and this,
making sense.
And then all of a sudden it came together, but it was so much information download that I just was like, I had to just make it stop.
Corner in the fetal position.
Couldn't function. So that was my first trigger, so that was fun. And I was kind of then dealing with this newfound raw person,
who you buried when you were abused
Right.
years earlier.
Yeah, so I'm having to kind of not relive the abuse, but come to different terms with it.
When I talk with people of abuse,
Yeah.
I say, like, they're stories that I'm writing, books I'm writing.
Yeah.
One woman watched her 6-year-old son get decapitated in front of her by her husband, who is mentally ill and is now in a mental institution. And human person, as you're saying, can only handle so much. So we shut off emotion. And so to write this book, I said, I will only ask you once to go there. We'll audio tape it so I never have to ask you again.
Yeah.
Because in order to heal, you got to go to that place of wretchedness.
Right.
Feel all those emotions again,
Right.
so that you're able to finally work with them and throw them away.
Right.
So it's like saying it's bad that you went to the pit, but it's good
Yeah.
that you went back to the pit,
Yeah.
because that was the beginning of your healing.
Yeah, because I wasn't able to move forward with anything in my life, even though I was extremely successful in my chiropractic career, and I had a really thriving practice, and my daughter was healthy, and life was good, and, you know, my dating life was never good, but, you know, that's because I made bad choices. But there was no reason for it, other than I was trying to get better with myself, and I was ready for that moment too. So there was a lot of layers to that. So I kind of went through that. Then I had some unpleasant things happen, and I had a really bad trigger that sent me into a severe insomnia for 15 days. And you know, you can't go without sleep for 15 days. Sorry. So I ended up doing a little bit of inpatient because everybody that loved me was helping me, and I was medicated, and the medication it was doing nothing.
Talk it out.
I needed to talk it out, and I had also had gastric bypass surgery, so you assimilate medications completely differently, and people didn't realize that at the time. So I was taking enough medication to drop a horse, and it wasn't doing anything. I couldn't walk, I couldn't talk, but I wasn't sleeping. So I did inpatient, and I came out, and I said, I went to my therapist, and I came out of that situation. I was 6 medications in the hospital, came out on 5, got down to 4, and I went to my psychiatrist, because you have to. And I said, in the first visit with her, I said, we are going to find a way for me to get off medication, because I don't do this. This is not how this works for me. And she was like, oh, you're so pretty. You're so pretty. That's just not a thing. You know, you have this.
Like, screw you, lady. Yes, it is.
Yeah,
I'm stronger than you're making me out to be.
Exactly. And I was like, first
of
all.
Did I say that loud on the air?
That was real. Yeah, it was your outside voice, but that's okay. I like outside voices. I use it a lot myself. So she was just like, you know, well, we'll just work with it and see what we got. But she never gave me any hope that there would be an end point. And I love psychiatrists. I think they're amazing people, but they, you know,
they practice their craft.
They do. If you have a hammer, everything looks like a nail. So that's all she had to offer me. So she was like, well, you know, we'll work with it. You know, but you know, there is going to be an end point, basically. And I was like, dude, you don't even know who I am. Like, this does not work in my worldview. So I went back to neurofeedback, and the practitioner had this wonderful system, and I thought,
you hadn't practiced neurofeedback.
No.
You had just seen it on your daughter.
Yeah.
So when you say I went back to it, you're like, I'm going to start it with me.
Yeah. So then I
check it out.
So I started with me, and I thought, I really love this technology, and why isn't this more readily available? Like, why did I have to come across this accidentally? Like, why don't I know about this? Yeah. So
he needed you to.
I started like researching, and then when I came across Brain Core neurofeedback, the guy that taught it and promotes it, I went to school with, and I was like, I know him. He's a chiropractor.
And you trust him.
I do.
Exactly.
I trust him. I've taken classes with him. I know him. He's a pretty great guy, and I know he's really super smart. So let me see what this is about. So he developed the system to be in conjunction with his chiropractic practice, because any of us practitioners know you can bake someone, shake them, fry them, hang them upside down, do the perfect thing for them physically. If mentally they're still not in a good place, they're never going to heal.
Well, that's a good thing about chiropractors anyway, is you guys kind of get the bum, you know, say, oh, they're no real doctors, because it's more of the holistic, and we are in an environment of medicating.
Yes.
And so
we're always looking for a chemical.
Absolutely, and it makes perfect sense. That you would be the guys who would also practice this neurofeedback, because you're working with the body and the spine, and let's work with the mind as well.
Yeah, and I think people discount the fact that because we don't have medications to rely on, we have to really think outside the box. Like, we don't have as much our toolbox is different, let's put it that way. So we really have to think outside the box for complete healing. So,
but you're a Christian too, so
yes.
you do believe that God provides all the medicines we've ever needed, and we just have to find them because we've screwed them up.
Absolutely, right? Yeah. And your body craves natural. You want to be natural. Yeah. You know, He gave us, our bodies are perfect the way they are, and that's chiropractic technique, above, down, inside out. That's what we live. That's what we breathe. So everything comes from above. Whether you believe that's God, whether you believe that's your brain, whether you believe it's the universe, whatever, it comes from above down, and then it manifests inside out. And neurofeedback works that way, chiropractic works that way, our bodies work that way. That's just kind of how it is.
I love holistic stuff, which is why I had you on the air today.
Oh, thank you.
So I want to remind my listeners, my guest today is Dr. Sherry Wright-Cox. She is you're a chiropractor, and you are a practitioner of neurofeedback.
Yes.
Yeah. Right, and she is the owner of WrightBrainCore.com. That's right, like her last name, W-R-I-G-H-T. If I'm talking too much and you forgot, it's like, wait, I'm driving, I can't write that down. When we are finished with this show, it will be uploaded to my website. There will be an image of the two of us, and we will put, if you click on that image, it will take you to her website, WrightBrainCore.com, and you can get more information about this.
Absolutely.
So it is some exciting stuff. We're really looking to help people who have so many, and fill in the blanks, but I'm looking at ADHD, PTSD, TBI, insomnia, which I hadn't heard of, depression, anxiety, any others that are
autism. I see kids, a lot of kids with autism and adults. Traumatic brain injuries, we said, but yeah.
So if you find yourself in any of those, and then some, you know, just things that aren't right, I would ask that aren't right. You should put that like a tag. Help me make things right again. Oh my gosh, let's do this.
That's it.
But you're going to have to do it after our commercial break. So I want you to stay tuned. You're learning a lot, as am I, about this intriguing subject of neurofeedback. But let's take this break. I'm Dr. Christine Bacon. You're listening to Breakfast with Bacon. Please stay tuned. Let's get it started. Isn't this stuff interesting? I love this stuff. Yeah, no? I mean, you say yeah, but I'm like so excited. I'm glad.
I want to hear more.
What do you want to hear? What questions do you ask? Oh, and before you do that, I took this off because if you hear in your ear, you can hear when you were doing this, it was picking up much more loudly than it's okay. I didn't reprimand you. And then the ring. So
I'm a fidget.
It's okay. You can do what you're doing. Just don't do it on the table.
Don't do it on the table. Got it.
Okay, so what were you saying you'd like to know? I can ask it.
I'd like to know more about like how it works.
So the science again. Yeah, I like the science. Okay, so we'll do as much of the science.
And if the science was already discussed and I missed it, it's because I was out there stretching and getting a coffee.
Oh, I didn't see when you were gone. Do you have enough water in there? Yeah. And you got yours? You didn't get any? How are you? Cool. Thanks for getting us hooked up. Are we hooked up?
Yeah. Well, we're not. There's no power. There's no power hookup, but we're still live.
Live. Awesome. Oh, so hey, good morning, Facebook people. They know me well enough. This is what happens during our commercial break. We're glad you're tuning in. This is Dr. Sherry Wright-Cox. So if this subject's intriguing you, you got to get a hold of her. What is it? The WrightBrainCore.com. It's some good stuff. And if you have questions, post them there. Eli will get them to me. We'll ask them on the air. And I have paper in case you need it.
Okay.
I do too. I guess I could open up the phone lines. I guess I could do that. Is it 222-3705? I think that's what it is.
That's it.
You know what? I don't. You know, a lot of people don't call. You don't know. I found that people are like, no, I don't want to call. I want to just listen. I'm like, what? Huh?
Michael will call you.
Yes, he will. And somehow he'll turn it back to Trump and the government.
No, he focuses. He's like, well, yeah, it's either Trump or the Pope.
We have a stalker listener.
He's got a bone to pick with one or the other.
Who doesn't, apparently.
Good old Michael. We all have our. He's a station stalker.
It's a caller that used to be a pest.
He's not watching us on Facebook. Hope he's not watching us on Facebook.
Doesn't matter. I would tell him that to his face. Well, I have told him that to his face.
Oh, you've met him?
Yeah. No, I haven't met him, but I've told him on the phone that you're aggravating and I'm going to keep you from calling.
Oh, and the only thing you need to remember is that at the end of the show, I say, remember always to live your life sunny side up. So when I say, remember always to live your life, you say sunny side up. You won't forget. It's always sunny.
to Dr. Christine Bacon.
Thanks for tuning in. I have a really intriguing guest today, Dr. Sherry Wright-Cox, the owner of WrightBrainCore.com. It's a neurofeedback practice.
Yes.
And we're talking about what neurofeedback does to the brain. But if you forget what we're talking about, or you're driving and you just don't have time to write things down, no worries. Go to my website, breakfastwithbacon.com, and this show, like all of my shows, will be uploaded to the website today. You can listen to the show again and again, get the information you need. You can, while you're there, by the way, go ahead and look at some of the other shows I've done in the past, because God has blessed me with some great guests. Ellen Petco was on, and she talked about her transformation. She's a Messianic Jew who was one day just sitting at a piano, and all of a sudden, and she believed in God, Christ. It's crazy. But anyway, so you can hear some great testimonies. You can have great guests on the air. And I think pretty much if it's a subject you're interested in, after about 9 years now, I've had that guest on the show. So I am going to open up the phone lines if you're interested in asking questions about this. Our number here is 757-222-3705. I wish we had Cox Cable's number. It's like 222-1111.
Right.
Never forget that, right? So 757-2.
They never answer though. That's the thing.
We're on the air. We got to be careful.
They're wonderful people.
222-3705. Call in if you are confused in any way or intrigued in any way, and you have questions for Dr. Wright-Cox about neurofeedback. Go ahead. I just want to remind you to listen to go to my social media, Facebook, Instagram. What are all the rest of them? Just go find them. We're out there. breakfastwithbacon.com. And one last thing, I am always honored to promote the book that God gave me to write, The Super Couple, A Formula for Extreme Happiness in Marriage. It is now out in paper, in audio, in ebook. You can get it wherever books are sold. I am just so honored. Download it on Audible, get it from Amazon. But I interviewed over 50 extremely happy couples to find out if extreme happiness was accidental or is it a formula. Thinking it might have been accidental, I found it was a formula. It changed my own marriage, which was extremely unhappy, very shortly to happy, very happy. And we're getting on the extremely happy, but I'm not fully there yet. But very happy is pretty dang good after
great.
20 years of, I'm so miserable.
That's amazing.
Yeah, so go buy a copy of The Super Couple, Save a Marriage, and help me so that when I die and I see God at the pearly gates, he says, you did save 1 million marriages, or he did through me. And so that's my thing. I think I've breathe that. Oh, and one last thing. I know that you just heard the commercial, but our sponsors, Our Lady of Perpetual Health, is amazing. Speaking of brain stuff, they work with your family members, your loved ones, with Alzheimer's and dementia, and they give them loving care at Our Lady of Perpetual Health. And I'm just so honored that they're sponsoring Breakfast with Bacon. So give them a call. All right, Dr. Wright.
Yes.
I want to ask you another question, a little bit off the subject, because you touched on it, and then I'm going to ask you a little bit more a faith issue here. My husband has insomnia.
Yes.
I mean, he's been diagnosed with restless leg syndrome and stuff, and I personally, he's like a pill popper because he's tried everything.
Yep.
But I am listening to you thinking, might this work towards getting him more sleep? He's got a lot of pain in his back, so we think sometimes it's back pain.
Yeah.
Feel that. What about RLS and insomnia and pain and all that comes together? He just needs to get some
and I've
rest.
had patients that have had restless leg syndrome before too. Again, it's about how you're using your brain. So everything starts with the brain map. We see exactly how he's using the brain. And then we look at the sleep center of the brain and we see, are you using the right brain wave at the right time, at the right space to do the right action? And that's kind of what we're looking at. And what are the accommodations to that? So I've slept a lot better, and again, I had intractable insomnia, and that's kind of my go-to thing that I've had since childhood. Sleep was never a safe space for me. So sleeping for me, when everybody's like, "Oh, I got eight hours of sleep," I'm like, "Wow, I got 4 hours of sleep." Like that's just how I function. So I go through these waves where now I can sleep for a week, 8 or 9 hours, and like a normal person. But 4 hours is a lot for me, so I get that. So when I first we talked about we do fast wave training and then we do slow wave training. Now slow wave training is a little bit different because I'm not trying to create a new neural pathway. I'm teaching you how to calm your brain down. So it's more of an experience. So that's called slow wave training or alpha theta training. And we're getting you into what's called an alpha theta flip, where you're actually taking those waveforms and you're flipping them. And it's almost what they consider the meditative space, but it's your creative space, that calmness where you don't have the fight or flight response anymore. So that's what we would use for insomnia, PTSD. A lot of abuse patients will do this. Alcohol and drug addictions, they use it in addiction centers now too. For drug and alcohol addictions, they
use neurofeedback?
They use neurofeedback, yes. Belle Isle.
Is this for people who have already admitted that they're alcoholics?
Yeah,
or
these are.
who doesn't admit it yet?
So,
not yet. We're not able to work with that.
yeah, they got to come in first, so they got to have a reason. But a lot of times we'll identify that they have been self-medicating with alcohol and aren't tagging it as I have an addiction problem. It's more of a I don't sleep, or I have depression, or I have anxiety, and they're trying to self-medicate. So there's those layers too. But Belle Isle Salvation Army in California, one of the largest Salvation Armies, has neurofeedback on site, and there's a wonderful YouTube video that they did where they were taking people that were homeless, they were abused, they had drug and alcohol problems, then they have ADHD and all these other things, and through neurofeedback, and then they have their wonderful teaching centers where they teach them how to, you know, find a job and how to anger management issues and parenting classes.
They were dealing with the core issues of homeless people first,
yes.
and then. Well, do you have any stats on how many of them are coming off the streets?
They their success rate is like over 80%. I don't want to say an exact number, but yeah, it's over 80% that they don't return to drugs and alcohol after leaving that program because they've added neurofeedback to it. So that some of your also higher end addiction centers are now using neurofeedback too, and then the alpha theta is what we would use in Brain Core to help someone with those addictions, because it allows you to get into the long-term storage of your mind, because that's where all abuse and issues of that nature are stored. So it allows you to get into that long-term storage to calm your brain down and remove the fight or flight from it. So someone with PTSD who has a trigger may have their feeling come up, but they take that reaction out of it, which is what a trigger is. It's an abnormal reaction to a perceived threat of some kind.
Right.
So it allows you to separate the physical response from the emotional traumatic event. And that's how a lot of people with PTSD use neurofeedback to heal. And it's a really beautiful thing. And that's kind of what I've done a lot too, is done a lot of fast wave training in the beginning, get my brain healthier and more efficient, working efficiently, and then do the alpha theta training to deal with the emotional response, which is wonderful because you want to kind of get there. And anybody that I see that has ADHD or even other things that we're working on, which are fast wave problems, I'll introduce them to alpha theta because I want you to learn how to be able to do that when you're not with me, how to calm your brain down, how to get into that long-term storage and allow those emotions to kind of surface and then resolve the physical response to them. So you're not letting down your too much beta, you're not going into fight or flight, you're not activating that central nervous system in response to this feeling that you're having. So
some people are probably scared, thinking you got them poked with probes and things. Tell me, take me to a session. I walk in your front door.
You walk in
do
the
I
front door.
have to put a headset on? What am I doing?
So when we decide we're going to do a map, you get this same cap that you would get if you went to the neurologist and they were doing your EEG for your brain. So you put the cap on, we put gel in the different little holes, and then we plug you in. There's no electricity, it's okay.
And then plug you in. Just the hat is being read?
Yeah, the hat is being read. So you get that into the amplifier. So then we go through and you do 1 minute for each.
Are you laying down? Are you sitting?
You're sitting up. Yeah, you're sitting
watching
up.
that TV show you were talking about.
Actually, you're just going to focus on something that's calming to you.
Okay.
So we have like pictures and stuff that you can look at. My drapes have a big brain on it. Everybody kind of looks at that because it's multicolored and they're like, they think they see things. It's kind of cool. So anyway, you're focusing on that. We do 1 minute with your eyes open for each piece of the brain that we're monitoring, and then we do 1 minute with your eyes closed that we're monitoring. So you end up doing 12 minutes. It's 6 minutes eyes open and 6 minutes eyes closed. And that's really the extent of the map. You just sit there, you keep your eyes open when I say keep them open, and then we do closed, and then we do them all closed. And then we read what the map has to say. We remap probably, depending on the type of what we're trying to accomplish, we may remap every 10 to 15 sessions depending on how the patient's doing through training. But the initial map is kind of amazing because it also teaches you about the health of your brain. So at the end, We have deviances, so we can say, oh, you may be hypoglycemic, so that's something you want to get checked out. You might be deficient in certain nutrients you want to
And
get
you can
checked
see
out.
that just by mapping the brain?
Yeah, because you're going to have certain patterns that we're looking for. So.
Wow, I would have thought you'd had to do a blood test or
Yeah,
something
and
like that.
basically it says, hey, most people that have high posterior
This
beta
type
will
of-
have this, like hyperglycemia, or
Go
this
get
could
your
be
blood test.
too much stress, or you have inflammation in the brain. So then it says, okay, you want to alert your medical professionals that you need to explore this a little bit more, make sure it's, it's good. So it's a nice way to have a check in that respect. And then we go through nutrients deficiencies. I also do metabolic screening for anybody that comes in, so that we're looking to see if there's a pituitary problem, if there's a thyroid problem. It's all self-reporting. We give you a symptom list so that we know that there's nothing else that we need to address as well. And then I make sure you get back to your primary and do all that fun stuff. So we look at you completely, not just your brain, but how are you doing physically, and how are you using your brain, and how is that, connecting to each other.
So so I'm coming into your office,
Yeah.
like how many times a week?
When we decide to train, you want to train a minimum of twice a week. You can train every day if you want to. For those people that have like an anxiety attack or something major is going on, they can even train twice a day depending on what's going on. So like for my daughter, if she has an anxiety attack, she'll come in, she'll train, I'll wait a couple hours, we'll train again, and it usually will break the anxiety attack, which is really kind of nice. But for the average person, you come in twice a week. Now
For hour, half hour?
half an
15?
hour. So you're going to watch your half an hour show, you're going to get trained, and then we're going to record that, and then you come in next time and you pick up where you left off. You can watch a different thing every time, you don't have to watch the same thing, you get to pick. And then we monitor you, and then once we start seeing the pathways get healthy, you get a strong pathway, we remap to see if there's anything else that we need to do. Because a lot of times there's different areas of the brain we need to fix over layers. So we take the priorities first, and then we go to the next priorities, and then we so the average person will do.
That was my next question.
Yeah,
how many sessions?
How many times are you gonna come in? Oh, so most people will do the average non-complicated case, and by non-complicated I mean they don't have a lot of other health issues.
They might have just the ADHD.
Right. So when they come in, they're not medicated, and they don't have a lot of other health stuff. Most of those people will do about 30 visits, 30 sessions.
So we're looking at 15 weeks-ish.
Yeah, and you can take the slow road or you can take the fast road, depends on how much you want to come in. So if you want to come in, 3 or 4 times a week, then we can get done a lot quicker. So it's more the number of sessions, not how there's.
Do I have homework in between?
Yeah, so I try to give you homework. We also do interactive self-assessment, and that's mostly how you fare with your peer groups as far as who you are as a person. So how are you on the independence scale, independence, assertiveness, that kind of stuff. And then we kind of see if there's anything that you want to work on there, and then it gives you homework as well to do that too.
What's the homework though?
Homework is like if you extremely dependent person, so you fare way outside your peer group for your age and your sex. It might say learn how to do things on your own or take small risks, and it'll give you little pieces of homework to do. It's I like that for my teenagers, not so much for my adults, because they're like, yeah, that's great, I've been this way forever, I'm not changing, so that's
Cool.
fine, and that's
I've
fine, I'm
adapted to
good,
the
I'm
new me.
good, yeah, that's right. I like being dependent, it's fine. Or
Which is true, though,
assertive
you're
has
right.
always worked for me, so.
Right.
Yeah.
And if it's worked and we're comfortable with it,
Yeah.
this is designed for change. It's like I just can't deal with this aspect of myself
Exactly.
anymore, so I want to change it.
Exactly, and I am a huge proponent of talk therapy too, so I
Send them to me.
yes, I prefer everybody that does neurofeedback that also does talk therapy. I don't do talk therapy professionally. Obviously I'm a great listener, I can give great advice, but I want someone that's also following you, because you're going to unpack a lot of stuff, especially for dealing with long-term depression or long-term anxiety or PTSD. You're going to unpack a lot of stuff when you're doing this, when your brain's getting healthier.
Yeah.
And, emotionally you're going to have things that are going to happen, spiritually things are going to think because you're
What do you mean by talk therapy? Do you mean like a counselor
Yeah,
or
counselor.
a psychiatrist or a psychologist?
psychologist, a psychotherapist of some kind, yeah, who specializes in what you're going through. And I always like to work with your medical doctor too. So if you come to me medicated, so let's say your primary care is giving you your antidepressant, I want to work with them too, because over time what we're going to see, when your brain is able to make the chemical that we're trying to create, you're going to need less and less of that medication. So sometimes you'll actually feel worse before you feel better. So if you've been medicated for a long time, I always say, look, because your brain is going to start
detox.
Yeah, so you got to detox. You've got to your brain's going to let down more of this neurotransmitter, and you're getting it chemically. So something's got to give. So you're going to need to start weaning off your medication. I always make sure that their primary care is involved in that, or their psychiatrist. If they're not on board, it makes it a lot more challenging. So I try to communicate with them completely during this process because they want to be involved and say, look, I'm doing this therapy. There's a chance that I will be able to get off this medication, and I want you to be able to monitor it and always make sure they come off their medications correctly too. I don't ever tell anybody you need to stop taking your medication. It's terrible. You should never do it.
Right.
Ever do it. And there's a lot of physical complications that can happen. You know, we don't want any of that. So
A question came to me while you were talking.
sure.
Pornography. There are a lot of people who are addicted to it, and I know it rewires the brain.
It does.
And
it's
dealt with people
it's
with
a
that
super
issue.
stimulant. Well, if I have, they haven't.
So
said it
none have
specific-
presented it. I'm addicted and I need
Yeah.
this to go away because I hate it.
Exactly. They'll more come in with depression, or they'll more come in with anxiety disorders.
And then you kind of find out wrong about.
yeah.
So if someone's listening now and he or she,
Mhm.
mostly he's,
Mhm.
are addicted to porn and they've been crying
Women
out to
too.
God, I know sadly more of them more
Mhm.
often,
Yeah.
and have been crying out, I just need to get but they're still, so it sounds to me like you can help them rewire so the brain gets
Sure.
pleasure from other things
Exactly.
instead of just those images.
Exactly. So it's a stimulant like anything else. So you're again looking for that chemical letdown. We're always looking to get the chemical balance that makes us feel comfortable in our own skin. And that's why we self-medicate. That's why we do pornography. That's why we do extreme sports. That's why we're always looking for that chemical
Some
balance.
of us love that adrenaline.
Yeah, because that's the chemical balance that makes me feel comfortable in my own skin and makes me feel the most authentic. So they're going to get it from somewhere. So, and pornography is not necessarily just because it's sex, but it's extremely stimulating. It's so taboo. You're
Yeah.
going to let down a lot of those neurotransmitters.
And a lot of the people are no longer sexually stimulated by the average
sexual experience.
Right, they
Yeah.
need more and more and rougher, so it
Yeah.
sounds like this can help them get back to
Yeah.
having that letdown of hormones on pure,
Yeah,
you know,
do the way it's supposed to be.
the way
Yeah.
it's supposed to be, kind
Absolutely.
of sex.
Yeah.
Wow, let me ask you this straight up, where is Jesus in all of this? Because I know you're a Christian.
Yeah, so
He's always been a part of your life. What's he think about neurofeedback?
he thinks it's awesome. Yeah, absolutely. So I had a patient ask me the other day. She said, how does my faith dovetail into all of this? Because
How does it affect your world, affect your practice? Yeah.
Exactly. So I always say there's healing on multiple levels. Okay, spiritual, emotional, physical, even your mental, intellectual. You have to heal on all of those levels.
And they're all connected.
They're all
mind,
connected.
body, experience.
Exactly. Can some be more damaged than other? Absolutely. Can you have a spiritual problem that manifests itself physically?
Yeah, it's what exorcism does too.
Absolutely.
It's for that spiritual issue.
Exactly. So you have to heal from all of those different levels. So where spirituality comes in is if you're giving all your problems over to God and He's giving you that peace and that understanding that surpasses all understanding, that's wonderful because you're going to use your brain a whole lot better and you're going to get the chemicals that you need. So it's all interconnected, and it's just another way that you have to heal. I can help get your brain working better, but you have to continue on your journey to make sure that you have complete healing, and that's spiritual and that's emotional. If you are still in an abusive situation and we start working on your brain, you may have a little bit more confidence to get out of that situation because your brain is working better. But if you don't get out of that abusive situation, you're continually altering your brain chemistry and you're just going to keep hitting yourself against a brick
Feedback
wall.
loop.
Exactly.
Feedback loop. Wow.
Exactly. So you have to do the work outside this, but it's another way to make sure that process gets started so that you're healthy enough to be able to do all those things that you need to do. Absolutely.
How about success stories? Can you share any?
Sure.
Without names, of course. Unless they told you could use their names.
Yeah, I've had several ADHD kids that are doing fantastic and they're off medications and they never thought that was a thing. So I've had several of those. I felt like I was running a 2-for-1 special on teenagers this summer because I saw a lot of them, varying degrees of issues. I've even had a set of twins and they were amazing, and it was neat to be able to train them at the same time because if you looked at them, they looked exactly the same, but their brains were completely different. So I could come up behind them and look on the screen and I'm like, oh, I know who that is. Oh, I know who that is, just based on how their brain
Did
was
one have a healthy
functioning.
brain and one not?
They
or
were
what?
they were suffering from different things. One had anxiety, one had depression, and they presented extremely differently. And they were both tagged with ADHD. So it was just interesting what their coping mechanisms were. Number one, and there's a lot of layers of that. So even with coping mechanisms, you're going to alter the way you use your brain. So one had, you know, so if you take two people and they have the same adversity, you know, why does this one choose this path and why does this one choose that path? And this was a beautiful way to kind of see what that's like. So you can be raised in the same household with the same parents and do the same exact thing, but when you come across something, we're all unique. My brother is exactly the same way. You know, my family background was a lot of drug and alcohol abuse, and we were just left with whoever would take $20 to leave us for the moment because my parents were super young, and you know, it's back in the 70s, and that's just what you did. So my brother, completely different from me. He went to the drug and alcohol way, and I went to completely the opposite. I went to sex, and I was like, no, I don't want anything to do with drugs and alcohol. So we just dealt with things very, very differently. And to this day, he's been in and out of drug rehab, he's been in and out of jail, and he's just still a very angry young man. We went through the exact same thing at the exact same time. We just learned to cope differently.
Have you introduced him to the neurofeedback? Is
I
he
want
ready
to. I know and I wish.
Ready.
Yeah, and you have to admit that you have a piece of your healing that you have to
you have a
control.
responsibility
Yeah,
for it.
yeah, because you know, especially when you're in addiction, there's a lot of blaming and a lot of finger pointing. And I was always the one that was the healthier one, I guess, on the outside, because he was like, oh, you got everything handed to you, and you did this, and you know, you went off to school and you did this. I'm like, I worked 3 jobs, and I put myself through school, and I did this on my own. Nobody ever handed me anything. But if you look from the outside, from his perspective, I always had the best of everything. I'm like, but I worked for it. There's a difference. So his perception of me is very different. Sure.
Is this expensive?
Yeah, well, insurance usually doesn't cover it, so that's the first
It's
question.
kind of like chiropractic.
Yeah, everybody says, you know, they shouldn't, some insurances are covering it on a very limited basis because they still somewhat consider it experimental, which it's not because it's been around 50 years. How much experimenting do one to do?
Right.
But so usually I try to stay on the lower end. So maps usually cost around $250. We get a ton of information.
We each get mapped once in the beginning.
Exactly. And then depending on the type of training that we're going to do, if we do more alpha theta training, then we don't really rely on the maps as much. We don't really need to do them as much. If we're doing fast wave training, I'm changing your program. I'm changing the protocol.
I'm mapping you
every 10 to 15 visits. So the average person will spend about $2,500. The more severe cases from beginning to end, and then more. Normally, people don't spend more than $3,500. And we do payment plans, and we have different ways for that to be cost effective. So the average training session is usually about $50, and the maps are usually about $250. So it kind of comes out in the wash. And we do have a home training unit now, so we can actually send the unit home with someone. So especially if you're doing a lot of alpha theta training and they don't want to come in, especially if they're dealing with a lot of issues.
You teach us how to do it?
Yes.
Is it easy?
Yeah. So basically, you turn the machine on and it says, welcome to training. And it tells you where to put your little sensors on, and then you turn your music on and you do your thing, or you put your show on, you do your thing, and it says hit save. And then I get it remotely, so I'm always monitoring you. So I have that for people that travel a lot of people that are super stressed out, that travel a lot. The home unit is a really good option. I've had people who are super, super sick and just can't come in, or have social anxiety disorder. I've had that, and they just cannot.
I would think then things like agoraphobia or other phobias. Yeah, right.
Exactly.
What are some weird things I wouldn't think of that you have?
Well, you know, and then they don't want to be in the machine that everybody else had, so they're germaphobes.
Germaphobes have a daughter like that.
Yeah, so it's a thing.
It's a thing. My daughter will come out of the bathroom, did you wash your hands? I said, A, is it any of your business?
Nice.
B, I raised you.
How do you think you learned that skill?
Exactly. I'm like, oh my gosh. So there are people listening. What would you like to say, you know, to someone out there specifically that you just feel the Lord is listening and
I just
needs
think the reason I brought this technology onto my practice, and I actually have put aside my chiropractic practice. I'm doing that much less now, and I'm doing more neurofeedback because I think it's a better way to heal. And if you've been taking medication for a long period of time, or if you feel completely broken, you're like, my brain just doesn't work. You know, people come to me, my brain is just, I don't know what's wrong with it. It's just not working. It's not doing what I need to do. Those are the people that I want to see. Even if you only come in and get a map to say, I want to see what my brain is doing. I've had people just say, I want to get a map just to see how my brain is functioning. That happens more like I've done that with post-cancer patients that have had chemo and radiation, and they thought, I'm having a lot of memory loss. How is my brain working? So
Can it help with that? Can
Yeah.
it help find memories?
Again, we're going to stimulate different, probably not fine memories, but we can
Yeah, but
stimulate
if
your
it's
memory.
stimulating the part of the brain that holds memories,
Yeah.
I would think that some of them might start breaking through.
Yeah, and then that's when we would do the alpha theta, because that's where your long-term memory is stored, so definitely. And then the short-term memory is more frontal stuff, so that would be frontal stimulation.
Wow, this is just intriguing.
Yeah, and it's really simple if you think about it. Your brain governs everything, and your brain loves chemicals, and we're just teaching you how to make those chemicals naturally the way you're supposed to anyway. So we're really just getting you back to the beginning, I guess is the way to say it.
Yeah, kind of that set. What'd you say? The factory
Factory-
default.
Go, yeah, go
Your
back to factory settings.
default.
Yeah, yeah.
That's so funny. So name one thing you'd have our listeners do differently as a result of something they heard today.
Definitely see if you are taking medication, you feel like there's no hope that you're just going to be on medication for the rest of your life. Really start to evaluate that, and if that's something that you want to get rid of, definitely start to seek out the more alternative therapies. No one has to ever take a drug. You just don't. I mean, unless you're diabetic, then that's kind of a thing. But
Maybe
Yeah.
in the future you can stimulate the part of the brain that produces the insulin.
that would be great. So the neurotransmitters and hormones work together for sure. But I always want to give hope to people that feel that they're hopeless or that they're in a situation where my brain is just not working, or I have severe ADHD and I haven't been able to hold down a job, or I can't get rid of this drug and alcohol no matter what I've done and I've done rehab in the past. This is a different way to attack that problem and to have more healing. We are also starting a nonprofit for PTSD for veterans and first responders, but we also are reaching out to children in foster care. So that's something that our practice is starting to address. So over the next few months, we're starting to put the nonprofit together. So that's going to be kind of amazing, because I want people to be able to have access to this technology. And we're going to be working through grant programs and things of that nature, so that this can be an affordable technology for everybody to have.
This has just been amazing. I am sorry it took me so long to get you on the
Well,
air.
thanks for having me.
Oh my gosh, so if people are interested, they can not only go to your website, wrightbraincore.com. Do you have a phone number you want to put out there?
It's 757-358-0346.
Say that again. 757.
757-358-0346, Wright Brain Core.
And will they talk to you or
Yes.
a secretary?
They'll
or
talk
what?
to me, they'll talk to Rini or Maria. They also work with me. I also have Rhonda and my husband Kevin. So
Who
there's,
you've rooked into.
I
Honey, I like this.
did.
You're going to like this
yeah,
too, right?
you're so getting certified. Oh yeah, that's a thing. So,
Oh my gosh.
so it's a family affair for sure.
Well, it's been amazing, and we've sadly got to go off the air again. So I'll be in touch. That's for sure. I've enjoyed my guest today, Dr. Sherry Wright-Cox, owner of she's a neurofeedback practitioner as well as being a chiropractor. So you can go ahead and see her for that. You want to get your brain trained. You want to fix some of these things you're dealing with. Look for them at wrightbraincore.com. If you forget that information, go to my website, breakfastwithbacon.com. Click on the image of the two of us, and that information will be behind that. But until then, I've got to go off the air. So, you with me?
Mm-hmm.
Thank you for listening. I'm Dr. Christine Bacon. You've been listening to Breakfast with Bacon. I want to remind you always to live your life sunny side up.